Okay, we're here with Paul Thomas, infection preventionist at Ministry St. Clare's Hospital in Weston. Paul, flu continues to affect those in our community with schools back in session, people going to work, and just a lot of illness out there. So let's talk, if we can, again about a little bit some basics about the flu. How is it spread and how people can prevent themselves?
Yeah. Since December 15th, we've seen our influenza cases increase dramatically. We know that there's a lot of flu in the community.
So, obviously, if people are out and about, you're covering your cough, washing your hands, those things are all vitally important to keep these things from spreading.
Right. Influenza spread from little droplets in the infected person's lungs, and as they're coughing, talking, sneezing, you can inhale that and become ill yourself.
Yeah, and obviously if you're getting ill, there's a couple of options. You go see the doctor, or something else we frequently see is people may go visit people that may become hospitalized, so they want to protect themselves. So we're here with one of our cough kiosks that you can find at entrances to many ministry facilities throughout the system. If you're coming to either go to the clinic to see the doctor or visit a patient, what are some of the basic things people should know?
Well, if you're coming in ill, we want you to not spread the influenza. What we have here are adult paper masks. Mask is applied by putting the ear loops over the ears, opening the mask, and there's a little wire on the top, so you have a good seal so that those tiny droplets aren't exiting your lungs and you're cross-contaminating. These are disposable. We want you to place the mask on when you enter the building, and then upon leaving the building, we can throw them away simply in the garbage can. The other items on the cough kiosk are tissues, because coughing is prevalent with influenza, and cleaning the hands. This is a battery operated. Putting the hand underneath will dispense an amount of the hand sanitizer. So you've cleaned your contaminated hands, you're covering your face with your mask, you're having your physician appointment. Let's talk a little bit about visitors. You have a loved one in the hospital, you're not feeling well. We would encourage you to rest at home. Use the telephone, use the computer to communicate with your patient. If you absolutely have to come to the hospital and you're ill, again, cough kiosks are available, placing the mask to contain your bacteria, your viruses, so we're not spreading that to other patients, other people in the hospital, or when you're visiting your loved one, potentially infecting your loved one with your illness.
The other important thing would be, before you enter a patient's room, always check with the nurses station to find out what the precautions they'd like you, so it's a safe environment for everybody, right?
It's a good idea.
Yeah.
We do use isolation techniques to prevent the spread of germs in hospital. Yeah. If the patient you're visiting is in isolation, there may be some other special instructions that the nurse can provide to you.
I would think another important thing that we have there is both adult and child size mask. Important if you have a child, the right mask makes all the difference to get that important seal, doesn't it?
That's right. Children's masks have the Mickey Mouse, they're smaller, they fit the pediatric size face much better.
Yep. And same thing goes if you have the flu. Stay home from work, stay home from school. Please don't come and visit if you're not feeling 100%, and call your loved one and check in that way.
That's right.
All right. That's Paul Thomas, infection preventionist at Ministry St. Clare's Hospital in Weston. Thanks, Paul.